Hello guys, welcome back to A to Z Dentistry, a channel which features easy explanation of various medical and dental related topics. And our today's topic is Torus Palatinus. So without any further delay, let's get started. So today we will be studying Torus Palatinus under the following headings: Introduction, Definition, Classification, Clinical Features, Radiographic Features and Treatment. Moving on towards the introduction, so Torus Palatinus is also known as Palatine Torus, right? It is so because it is located in the palatine bone itself, right? It is a slowly growing flat based bony protuberance or an excrescence type of growth which occurs in the midline of the hard palate, right? So it is occurring in the maxillary arch, right? It occurs in about 20% of the population, right? So here are two pictures which are depicting Torus palatinus. Here you can see a bony projection, right? So this is nothing but your Torus palatinus. Here as well the same thing, bony projection typically in the midline of the palate, right? This is your Torus palatinus. Now let's try to learn the definition, right? So Torus palatinus is basically a benign bony growth or a protuberance or an excrescence that occurs through the midline of the hard palate, and it is usually covered by normal mucosa, except in few cases, right, it might get ulcerated due to some kind of trauma, right? But in majority of the cases it will be covered by your normal mucosa itself, right? It is basically a developmental anomaly of the maxilla. Typically, yes, of course, it's asymptomatic and it might vary in size and shape as well, right? So it is a benign growth, so nothing to worry about. Here you can see, right, variation in shape as well. See, it is relatively flat, and here you can appreciate the nodules, right? So we will deep dive into its various morphological types later on. But for now, you must understand that it is a benign bony growth, right, which is occurring along the midline of the hard palate and which is covered by normal mucosa. A type of dental anomaly of the maxilla, typically with no associated symptoms and of course varying in size and shape. Now let's discuss the etiopathogenesis of Torus palatinus, right? So our first etiology would be genetic factors, right? So in various books there are various strong genetic factors which are noted, right? So strong hereditary predisposition, as it shows higher prevalence in certain ethnic groups, particularly in Asians and families, right? And the mode of inheritance here is autosomal dominant. Okay. Second would be multifunctional factors, right? So functional factors are further divided into two types, okay? Masticatory stress as well as presence of any parafunctional habits, right? So in case of masticatory stress, what are included is nothing but chewing, right? So chronic stress on the palatal bone from functional activities like chewing may stimulate excess bone growth, okay? In parafunctional habits, of course, bruxism or clenching, right? So presence of bruxism may also contribute to Torus palatinus. So third point is environmental factors, right? So nutrition influences such as dietary influences, right, which require significant amount of mastication, right? So whenever there is excess stress on the bone, right, there is too much of stress on the bone because of some or other type of a diet, right, it will stimulate excess amount of bone growth, therefore it might lead to Torus palatinus. Apart from it, hormonal changes such as which occur during puberty, right? So puberty is a period which is marked by rapid changes in the body, right? So therefore it can also have some influence on the bone growth of the palate, right? So then developmental factors we have. These arise from excessive activity of the osteoblast in the palatine region during the development. Okay, so whenever there is more amount of osteoblastic activity, right, it can lead to formation of an excrescence in the palatine bone. Then overgrowth occurs along the midline suture of the hard palate where the two maxillary bones fuse. Here you can see, right? So this is your palate, this is the midline suture of the palate, and here any type of bony growth can occur, right? So starting from the anterior to the posterior part, right, anywhere you can encounter the torus. Let's move on towards the most important part, that is classification of Torus palatinus. So basically it is classified on the basis of morphology, right? On the basis of morphology, Torus Palatinus can be classified, right? So the first variety is flat, then we have spindle, nodular and lobular, right? So the flat, as the name itself is indicating, right, it is a flat type of bony growth, right? This is the most common type, a broad flat bony prominence with a smooth surface, right? Coming on towards the spindle. So it is a ridge-like elevation which runs along the midline of the palate, and the shape resembles a spindle or a ridge, hence named so. Okay. In the nodular variety, it is composed of multiple small rounded protuberances which are clustered together, something like this. Okay. Now each nodule may be distinct and palpable as well. Our last variety is the lobular type. It basically consists of large lobulated masses which are often irregular in shape, right? In case of nodular, we had multiple small and rounded protuberances, but here there are large lobulatory masses, right? And they are often irregular in their shape, and it gives appearance of multiple lobes which are fused together, right? In nodular variety, we had distinct nodules which are palpable. Here multiple lobes are fused together. So here are the clinical presentation of the flat variety, right? Here you can see this is your Torus palatinus, which is relatively flat, right, present along the midline of the palate. Here again same thing, right? You can see, appreciate very clearly. Right, this is your Torus palatinus of the flat variety. Okay. Here you can see clinical pictures of the spindle type of Torus palatinus. Here you can see, right, a spindle shape. Very well you can appreciate it. Here again same thing, spindle shaped Torus palatinus along the midline. So here are clinical pictures depicting the nodular type. Here you can see a single nodule. So in some cases there might be a single nodule, and in few cases multiple distinct nodules can be palpated as well. But this is a clinical picture depicting a single nodule, right? Here also same thing, a single nodule is seen. Here are pictures depicting the lobular variety. Here you can see lobes, right, varied in size. Some are big, some are small. Here you can appreciate, right, present along the palatal line. Here you can see, right, various nodules of different size and shape. Here also same thing, see the irregularity, can you appreciate it? One nodule is large, the others are relatively smaller in size, right? So this is the lobular variety. In nodular variety, we had equal size and shape of the nodules. In lobular variety, the nodules, right, or the excretions may vary in shape and size as well. Now let's discuss the clinical features in detail. So first we'll talk about the location, right? So as already said previously, it occurs in the midline of the palate, right? Here you can see it is occurring along the midline of the palate, and it might also extend to involve the palatal process of the palatine bone, right? So it might occur anteriorly as well as in the posterior part of the palate as well, and in such cases it will involve the palatal process of the palatine bone, right? And it is typically symmetrical. Here you can see there is a symmetry which is seen, right? So females are affected twice more commonly than males, right? So it has a predisposition for females. The development is initiated in young adults, typically before the age of 30, right? So more common in females, and the initiation is before 30 years. Moving on further, let's discuss about the appearance, right? So definitely bony, hard and non-tender on palpation, right? It is covered by normal healthy mucosa. Here you can see normal healthy mucosa, okay, and hard because it's a bony protuberance. Then size and shape, it varies in size and shape as well, right? So when variety of shape is concerned, we have already classified them on the basis of the morphology, right? So flat, spindle, nodular or the lobular variety. Here you can appreciate, right, this is the flat variety, okay. And then we have the lobular variety, nodular and the spindle type as well, right? So typically they are less than 2 centimeters in diameter. However, the size can range from small and barely noticeable. Here you can see only a single nodule is seen, right, to incredibly large sizes, right? And when the size is very large, it might interfere with the oral functions. As you can appreciate here, right, it's a very large lobular type, so it might hinder the oral function. Moving on towards the age and onset for Torus palatinus, it typically develops after puberty and it has a slow growth over the years, right? So the progression is very slow and it is developing after puberty. Now why? Because again the same thing, puberty is characterized by rapid growth phase, right? There is a rapid growth which is occurring and bones are also growing very rapidly, right? There is surge in the bone growth. Therefore this type of developmental anomaly is more likely to take place in the puberty, right? Progress, the growth may be slow or there may be a period of rather rapid growth which ceases altogether before the patient has advanced into the adult life, right? So we have seen that it is typically occurring before the age of 30, right? Before 30 years, right? So then the growth might be slow or there might be a period of rapid growth. So after puberty or during the pubertal phase there might be a rapid growth because the osteoblasts are already stimulated, right? Because of the hormones, right? As there is a upsurge in the hormonal levels during puberty, so the progress might be fast during that particular time frame, and then once the adulthood is reached the progression is very slow. So Taurus palatinus definitely has some ethnic predisposition, right? So higher prevalence is generally recorded in populations such as Asian, Inuits and the Native Americans as well. Moving on towards the signs and symptoms. So usually these are asymptomatic, right? It may become painful if at all it is traumatized or ulcerated or injured by food or some dental appliance, right? So usually as it is covered by normal mucosa, it's just a developmental anomaly which is benign in nature. Therefore it is non-painful or it is completely asymptomatic, right? But once some or other kind of trauma is inflicted upon this bony growth, then of course ulceration might occur and then pain will be a common symptom, right? Here you can appreciate it, there is a trauma, right? These ulcerative type of lesion you can appreciate here. So therefore in such cases pain might be a complete from the patient. So as it is a bony excrescence, we have to discuss its effect on oral procedures, right? So it may interfere with dental procedures such as during denture fabrication or placement of the dentures into the oral cavity, right? As it is a bony projection here, so you have to provide a relief area over here, right? So usually it is not associated when with some other conditions, right? No syndromes have been encountered with Torus palatinus as a part of the syndrome, right? It is just a benign developmental anomaly, right? So in this case you can see, right, this is your Torus palatinus and it is definitely affecting the placement of the denture, right? So here you can see a relief area is provided. Let's discuss about the radiographic features, right? So sight, if the torus has developed in the middle or anterior regions of the palate, it will be superimposed with apical area of the maxillary teeth, right? And if at all it occurs in the posterior area, it will appear on the roots of maxillary molars, right? So when it is located anteriorly, right, the anterior teeth are to be associated with that Torus palatinus, and if it is occurring in the posterior area then it will appear on the roots of the maxillary molars or the posterior teeth, right? So here is the CBCT image, right? Here you can appreciate the growth of torus, right? Here you can see this is your Torus palatinus. So right, it is occurring in the posterior region here and associated with the roots of maxillary molars, right? Let's talk about the radio density. So there is a relatively dense radio opaque shadow here you can appreciate, right? As this is a calcified mass, right, it will appear radio opaque or radio dense on the radiograph or in the CBCT images as well, right? Here again you can appreciate this is your torus. So here is an OPG again depicting the same thing. Kindly take a note of the margins or the borders, right? Well defined margins. Now I am stressing on these radiographic features because ultimately they will help you to differentiate Torus palatinus from other pathologies, right? So it is very important the radiographical features for Torus should be known to you so that you can arrive at accurate diagnosis. So the shape is more or less rounded and it has a sharply defined eminence, right, which stands well above the palate, right. So as it is located in the palate itself with well defined margins, right, it is sharply defined eminence which is invariably present on the palate itself, right. When we are using the occlusal radiography, the occlusal film that includes the posterior borders of the hard palate will definitely provide a good demonstration of the torus, right, which will appear ovoid in shape. Here also you can see, right, this shape, kindly appreciate this shape. Here it is appearing as rounded protuberance. In occlusal film it will appear oval in shape. So this part is very important to it. I have written some key identifiers for Torus palatinus, right. So it is distinguished from other bony pathology by its midline location, right, here. Then on the basis of symmetry, it typically is a symmetrical type of a benign growth on the palate, right, along the midline. So symmetry, it is a symmetrical type of bony protuberance and it lacks radiolucent areas, right. It is a radio opaque anomaly. So there will be no radiolucent areas and also there will be no aggressive features. By aggressive features I mean no signs of bone loss should be seen, right. Only then you can classify it as Torus palatinus, right. So 4 points: midline location, symmetry, it is symmetrical in distribution, lack of radiolucent areas and absence of any aggressive factors. So when any lesion is not fitting well into the criteria, right, if at all 2 or 3 key identifiers are missing, then you can suspect another lesion. But definitely in that case, Torus palatinus will not be your diagnosis, right? Then you will have to look for certain other key findings to label it as any other pathology. Lastly, let's discuss about the management part or the treatment part, right? So first mode of treatment would definitely be non-invasive, right. So observation, most of the cases require no treatment as it is a benign developmental anomaly which is asymptomatic, painless type of bony growth, right. But regular monitoring is sufficient and it is also required, right. So regular monitoring is necessary. If at all any ulceration or any kind of such trauma occurs, then pain might be a symptom. So therefore regular monitoring is necessary. Then patient education, right, we need to reassure the patient that it is a normal non-cancerous growth, it is benign in nature. So sometimes the patient may be very fearful of such conditions, right, a bony growth, especially if it is of nodular type, right, wherein a large nodules are present, then the patient might be in anxiety, like what is this kind of a growth, right. It also may appear as a cancerous growth to the patient, therefore reassurance is very necessary. And also you will have to advise for proper oral hygiene so that there is no trauma or irritation which is inflicted onto it, right. Because if at all any trauma is given to that particular area, then definitely there will be ulceration, pain and bleeding. So this was our conservative line of treatment, right, which we have discussed. Now let's move on towards the surgical line of treatment, right. So there are 4 indications, right, for surgical removal of Torus palatinus. First is definitely when there is a large torus present, right, which interferes with speech, mastication or oral hygiene. Yes, in such cases definitely surgery is necessary. Then if at all there is any difficulty in fabricating or fitting of removable dentures, right, then repeated trauma leading to ulceration or infection of the tori, or if at all the patient is complaining for aesthetic concerns or there is a general discomfort to the patient. Okay, so these 4 are indications for surgical removal of the Torus palatinus, right. So here you can see it is a relatively large growth. Okay, so here surgical indication is necessary. Okay, so for surgical procedure, it is generally done under local anesthesia, right. It involves excision of the bony growth and smoothing of the underlying bone. This is very necessary, right. So there should be a relatively flat area when you are removing the bony growth, right. You have to level the bone properly. Then care is to be taken to avoid any damage to the adjacent tissues, right? There are nerve bundles, there are arteries which might get damaged, so care is to be taken. Or in some cases perforation of the nasal cavity may also occur, right? Because we are dealing with the maxillary arch here, right? So these are the pictures, right? Take a note of this bony excretions, right? Then local anesthesia was administered, and then surgery was performed. Here you can see, right? And here after removal of the torus palatinus, and then sutures are placed. In cases we have to go for surgical line of treatment, then post-operative care becomes a necessity. Okay, so pain management is to be done with analgesics. Okay, then maintenance of oral hygiene is also necessary to prevent any infection in that area. Definitely avoidance of trauma to the surgical site, because any trauma might hamper the healing process altogether. Okay, so post-operative instructions are to be given to the patient. Then prosthetic considerations. So in cases the removable denture have to be fabricated, torus may need to be surgically removed or reduced, right, to ensure a proper fit and comfort. Here you can see, right? So horseshoe shaped maxillary denture is fabricated. Here you can see the torus, right? So here they have reduced the size of the torus and they have given the horseshoe shaped maxillary denture. So guys, that was all about torus palatinus in detail. I hope you enjoyed the video. If you like this video, kindly consider subscribing to my channel. I will be back with a new video very soon. Till then, this is Dr. Snehal signing off. Bye bye. Take care.